Here's something most people don't realize until it's too late. If you start asking too many questions, if you say no to a recommended treatment, the system can label you mentally unstable. Yes, really. There's a term they use, lack of insight, or worse, treatment noncompliance due to a delusional disorder. It means that if you refuse chemotherapy, if you want to try natural alternatives, if you question the side effects, the diagnosis, or even just say, let me think about it, they can write in your chart that you're mentally compromised. And once that happens, everything changes. Doctors stop listening. Family members get pressured. Judges and social workers may even step in, especially with children. I've seen it with my own eyes. Parents who wanted holistic cancer care for their child accused of neglect. Mothers who questioned vaccine safety threatened with CPS. Elderly patients pressured into surgeries they didn't want because their refusal was labeled confusion. This is not healthcare. This is medical coercion, wrapped in clinical language. And let me be crystal clear, there is a massive difference between being mentally unwell and simply not agreeing with your doctor. But in today's system, disagreement is dangerous. Skepticism is pathologized. Independent thinking is seen as a disorder. Why? Because if they can convince you, they'll control you. And if that sounds extreme, ask yourself this. Why does a system supposedly built on informed consent punish you for saying no? True consent means the right to refuse, not be shamed, not be gaslit, and certainly not be flagged as unstable. But we're living in a world where obedience is rewarded and hesitation is medicalized. And here's your reminder, you are not crazy for asking questions. You are not delusional for seeking a second opinion. And you are not mentally ill for wanting control over your own body. That is right. That is your power. And no white coat can take that from you. Follow me, because standing up for yourself in today's medical system isn't just brave, it's necessary.
This presentation represents the professional opinions, clinical experiences, and educational interpretations of Dr. Farah Agustin-Bunch. It is presented strictly for informational, educational, and motivational purposes only. Viewing, attending, or engaging with this presentation, or any content in any form created by, affiliated with, showing, or associated with Dr. Farah does not establish or imply any doctor-patient relationship with anyone. No personal medical advice is being given, and nothing in this presentation should be interpreted as individual medical consultation, diagnosis, treatment, or prescription. Statements made herein have not been evaluated by the U.S. Food and Drug Administration or any international regulatory authority. The experiences and outcomes shared are not typical and are not guaranteed. This content is not a substitute for professional medical advice. Always consult your licensed healthcare provider before making any health-related decisions. Copyright and content protection. This presentation and all associated materials, including video, audio, slides, graphics, and spoken content, are the exclusive intellectual property of Dr. Farah Agustin-Bunch. Unauthorized recording, reproduction, distribution, sharing, or public display of any part of this presentation in any format is strictly prohibited and may result in legal action. By continuing to watch, you agree not to record, screen capture, copy, repost, or transmit this content in whole or in part without express written permission from Dr. Farah or her authorized legal representatives. By continuing to watch, you acknowledge that you are solely responsible for your health decisions. You understand this presentation is not a medical service. You agree not to hold Dr. Farah, her team, or affiliates liable for any outcomes associated with the use or misuse of the information provided. Viewer discretion is advised. This presentation may challenge conventional beliefs and expose controversial topics in medicine, health, and regulatory policy. It is intended to empower, not to incite fear, replace clinical care, or offer medical guarantees. Your health is your responsibility. This is your opportunity to reclaim it.